Welcome to the deep dive. Today we're taking a really focused look at human augmented intelligence in healthcare.
Right.
Think of this as your quick way to, really get a handle on how AI is working with doctors and nurses, not replacing them.
Exactly. It's about partnership.
So if you want to understand this big shift in medicine, but without digging through stacks of research papers, you're in the right place.
Yeah, we're aiming to give you the core insights. Our mission today is really to break down the key ways this human AI collaboration is changing things: diagnosis, treatment, patient outcomes,
Mm-hmm.
based on what the latest reports are showing.
And we've looked at quite a bit of material for this research findings, stuff from medical associations, hospitals, even the tech platforms
Yep.
involved.
We've tried to distill it all down, give you a clear picture of what's actually happening right now.
So the big question really is, can AI actually help doctors spot illnesses faster? And, maybe more importantly, tailor treatments to you, the individual patient. Let's jump in and see what the evidence says.
Okay, so one of the probably the most immediate impacts we're seeing is with faster diagnosis.
Right.
And what's really striking here is AI's ability to analyze medical images,
Mm.
X-rays, MRIs, CT scans, and just crunching huge amounts of data way faster than any human could.
Uh-huh.
And that's where you see the potential for catching things earlier, like certain cancers, maybe.
Yeah, I read something about that spotting tiny things on mammograms years earlier. That sounds incredible.
It does. It really could boost survival rates if you catch things at stage 0 or stage 1.
It's almost like having this superpowered assistant looking over the scans, spotting things you might miss.
Pretty much. And speaking of speed, you mentioned sources, Johns Hopkins Hospital, for instance. They've used AI in their ER.
Oh, yeah. What did they find?
Well, they managed to assign patients to beds, get this, 38% faster.
38%. Wow. Okay, let's just think about that. That's not just making the hospital run smoother, is it? That could mean getting critical care faster, less waiting time when it really matters.
Exactly. It directly impacts patient flow and potentially outcomes. And it's not just logistics. Look at Mount Sinai Hospital.
What are they doing?
They developed an AI model um, to predict intracranial pressure, pressure inside the skull.
Okay, that sounds serious.
It is.
Oh.
And predicting it faster means doctors can step in much quicker for those high-risk patients. It's about anticipation.
Right, getting ahead of a crisis. And it's not just about images or predictions like that, is it? The sheer amount of new medical information. It must be impossible for doctors to keep up with everything.
Oh, absolutely overwhelming. The Mayo Clinic Press actually highlights this exact point. AI can sift through just mountains of information, latest studies, patient records, and pull out what's relevant for the doctor right there, right then.
Like a super smart research assistant on Paul 247.
Kind of, yeah.
Yeah.
Which leads us to things like ChatRWD.
Chat RWD, tell me about that.
So it's an AI specifically built to answer clinical questions for doctors in real time. And apparently it does much better than your standard large language model.
Get better.
Reports say something like a 58% success rate in getting the right answer, compared to maybe 2% to 10% for the general ones.
Wow, that's a massive difference. Why is it so much better?
Well, it's trained specifically on medical literature. Yeah. Real-world clinical data. It understands the jargon, the context, in a way general AI just doesn't. Yet, anyway.
So it's about specialized training, focused AI.
Exactly. It's a tool designed for the job. And it's not just finding existing info. The NIHR, that's the National Institute for Health and Care Research in the UK, they point out AI can analyze like fuzzy symptoms, combine it with your history, maybe even genetic data.
To suggest possible diagnoses.
Yeah, to help figure out which tests to run first, potentially saving valuable time.
So instead of a long process of elimination.
It could help narrow things down much faster, synthesize all that complex info.
And that speed, getting the diagnosis right sooner, I mean, that can literally be life-saving in some cases.
Absolutely, which naturally leads us from faster diagnosis into, well, how treatment itself is changing, personalization.
Okay, personalized treatment. Let's dive into that. How is AI making that happen?
Well, the basic idea is moving away from that, one-size-fits-all approach.
Right, because we're all different.
Exactly. AI is really good at analyzing all the stuff that makes us unique, our genes, lifestyle, medical history, finding patterns in all that complexity.
And using those patterns to, what, design a better treatment plan?
Essentially, yes, to help doctors create plans that are much more precise, more targeted to the individual.
And where are we seeing this make the biggest difference right now?
Oncology is a huge one. Cancer treatment.
How so?
AI can analyze the specific genetic mutations in a patient's tumor, like really drill down into the cancer-specific biology.
Okay.
And that allows doctors to pick targeted therapies, drugs designed to attack those specific mutations.
Which means more effective treatment.
Yeah.
Fewer side effects, maybe.
That's the goal. More effective and potentially less harsh than, say, traditional chemo that affects the whole body.
That's a really significant shift for cancer patients. Are there other areas beyond cancer? Chronic conditions, maybe?
Oh, definitely. There's a company called OneDrop, for example.
One drop.
Yeah, they use AI for managing chronic conditions like diabetes.
Yeah.
Their app gives personalized coaching, predictive glucose readings.
Yeah.
It helps people manage their own health better day to day.
So it's empowering the patient more directly, like having a smart health guide in your pocket.
Kind of, yeah. It gives you insights based on your body's patterns. And the NIHR again mentions potential in, say, cardiovascular care too.
Right.
Tailored medication recommendations, specific lifestyle advice based on your individual risk factors and genetics.
So not just eat less salt, but specific advice for me.
Exactly. Much more patient-centric. The idea is, better adherence, better results overall.
Which, okay, brings us right to the bottom line, doesn't it? Improved patient outcomes. Is all this speed and personalization actually leading to people getting better?
Well, logically, it should, right? Faster diagnosis, more tailored treatment, you'd expect better results.
Makes sense.
We talked about catching cancer earlier. That directly links to better survival rates in many cases. Time is critical.
Right. And you mentioned Mount Sinai predicting those critical care needs.
Yes. Using AI to allocate resources more efficiently, getting the right staff, the right equipment to the right patient faster that can save lives. It's about optimizing the system based on real-time predictions.
Okay, so optimizing hospital resources. And what about things like OneDrop? Does managing diabetes better translate to better outcomes?
Well, the World Economic Forum suggests these kinds of personalized management tools can improve quality of life and maybe even reduce hospital readmissions.
Fewer trips back to the hospital, feeling better day to day. Yeah, that sounds like a definite improvement.
Absolutely. Even the faster bed assignments at Johns Hopkins, less time waiting in the ER, faster access to care that contributes to better emergency care outcomes.
So it seems like there's definitely potential here. Faster diagnosis, personalized treatments leading to potentially better outcomes. But there have to be caveats, right? It can't be all smooth sailing.
Oh, absolutely not. And this is crucial. The improved outcomes really depend on deploying AI ethically and equitably.
Okay. Ethics. Let's unpack that. What are the big concerns?
Well, trust is paramount.
Yeah.
The World Medical Association, the WMA, they emphasize that these AI systems need to be transparent, reproducible, meaning doctors and patients need to understand, basically, how the AI reached its conclusion. They need to be able to trust it. You can't just have a black box making life and death suggestions.
Right. You need to maintain that patient-physician relationship, the trust there.
Exactly. Transparency helps validate the AI's findings and builds that necessary trust. And then there's the massive issue of bias and equity.
Bias in the AI itself.
Yes. The American Medical Association, the AMA, and others are really stressing this. AI is trained on data. If that data reflects existing healthcare disparities, or if it's not diverse enough,
then the AI's recommendations could actually worsen those disparities, make healthcare less equitable.
Precisely. It could lead to skewed outcomes for certain populations. So designing AI that's free from bias, that actively promotes equity, is absolutely critical. We need diverse training data sets.
So it's not just about the tech working, it's about making sure it works fairly for everyone.
Yes. And as generative AI gets more involved in clinical decisions, transparency becomes even more important. OSF Healthcare noted this: we need clear policies, clear guidance.
It feels like the technology is maybe moving faster than the guidelines sometimes.
That's often the case,
Yeah.
which is why these discussions are so vital. But it's important to remember, as I think an anesthesiologist from Mount Sinai put it, AI is a tool.
A tool to help the humans do a better job.
Exactly. The human doctor remains responsible for the patient's care. AI assists, it augments, but it doesn't replace that human judgment and empathy.
Okay, so wrapping this up then, what are the key takeaways from our deep dive today?
Well, I think it's clear that human-augmented intelligence, this partnership, shows, real promise. Speeding up diagnosis is a big one.
Right, potentially catching things much earlier.
And personalizing treatment, moving beyond one-size-fits-all to something tailored to the individual.
Which, combined, suggests the potential for genuinely better patient outcomes, better health, better quality of life.
Definitely potential there. But, and it's a big but, we absolutely have to nail the ethical side.
Transparency, building trust, tackling bias, ensuring equity. These aren't optional extras.
No, they're fundamental to making this work responsibly and effectively for everyone.
So that leaves us, and you, the listener, with a final thought to chew on. As this tech keeps advancing so rapidly, how is this evolving relationship between human expertise and AI smarts going to reshape how we even think about healthcare, about patient well-being?
Yeah, it's a big question. What's that right balance between the power of the technology and that, essential human touch in medicine?
Something to keep thinking about. Hopefully, this deep dive gave you a solid foundation for understanding this really transformative trend.
And maybe spark some interest to look into those sources we mentioned, or just keep following this space. It's certainly not standing still.